All right, hello everyone. So today we're going to be talking about the limited access to resources in rural communities. So this is the topic I chose to talk about for my advocacy plan throughout the, the semester. It is something that I hold very dearly because I did grow up in a rural area and I kind of know firsthand how it is to live with the limited access, especially coming to a big city like Charlotte. So I do want to preface that although you probably never lived in a rural community, everyone is still affected by it. The people around us that we talk to might live in a rural community, and you can definitely see the differences. So that's kind of why I wanted to touch on this subject. So, in today's agenda, we're going to be talking about the population and the issue, my measurable goal, the objectives, strategies, and actions, and the reflection. So, with the population and issue, the population I chose was rural communities, and the issue was dealing with limited access to resources such as transportation, childcare, and community programs. So, with transportation in Charlotte, we are fortunate enough to have the CATS bus. So, I really love how with clients you are able to say, hey, you can take this bus and you can take this route and you will get to your destination of what I provide for you. Or if you want to come to me, this is what you take to get here. But that's not available everywhere. I know where I live, the closest bus stop is 40 minutes driving. So it's not walkable. A lot of places are not walkable. And as a social worker, how do you want to give your client access to transportation, or how do you give your client access to transportation when they live in a rural community? The second topic was childcare. So it is very expensive to have childcare nowadays, and when you have more than one child, it becomes a lot. And so I kind of wanted to talk more about the aftercare programs more than the childcare in general, but anything counts and anything works as long as if it's an aftercare, if it's an all-day care, anything helps. So I did want to speak more of the aftercare part, and then community programs. So just what I kind of wanted to talk more about was telehealth. So again, the same thing with the transportation stops. There's not a lot of hospitals around, and there's not more than just one. So maybe it takes you 35 minutes to get to the hospital. So how do we provide health to clients that are not fortunate enough to have someone or have their own car to drive them to the hospital every time they need to, or every time they have an appointment? So I did want to speak on that. That's why I chose these three services to talk about and find a solution for them. And fun fact, in North Carolina, there are over 78 communities that are known as rural. So, fortunate for y'all, there is a picture that I wanted to show y'all, and it is from the NC Rural Center County Classification. So, this is a website that talks all about rural areas and how they are specified as a rural community. So, this website, they look at the population per square mile of the county. And so that's how they know if it's a rural area or not. And that's how they calculate it. So in the green, it's all the rural communities. The blue shows the suburban areas, and the orange shows the urban areas. So if we look into Charlotte, there's a lot of orange and blues because it's all the urban suburban areas around it. But you quickly see that it's green after that. And I can't show you now, but if I on the green, you can click it and it will actually show you what county it is, the population, and if it's urban, rural, or whatnot. So I live in this little county right here next to Fayetteville, and it's known as Hope County. And so we actually have a population of 58,000 people. So the surveys are from 2020. They do update them periodically. But although we have grown, we haven't grown enough. And again, if we grow, everyone else grows. So it's not enough to where we're getting the transportation services or we're getting more hospitals put in place. Again, we are very fortunate, my county is very fortunate to have 3 hospitals, but in places down here like Robinson County, they probably only have 1. And it's in the tip of their county, so other people would have to drive up. So I really like this website because it, again, shows you so much of North Carolina and what is known as rural, what is known as urban and suburban, and the population sizes. So that's really good to see. And then my measurable goal. So my goal was to increase the availability of social services in rural communities by 25%. Now, it looks like 25% is a lot. I know. But if you divide it by the 3 things that I talked about, so transportation, childcare, and community services, if you divide 25 by 3, you let me know the number, and that's where we're going to go with. And so with the small steps that I planned to do to reach my goal was to partner up with local government. So I made a silly little comment in my notes whenever I was doing the advocacy plan to say, hopefully it's not shut down, and luckily it's not. So I would partner up with my local government and community organizations to help arrange helpful resources. So this has a lot more to do with the child care and transportation thing. I don't know how much help we would get from the community organizations, only because we're so limited by the community organizations. So I would more rely on the local government to reach that goal. And so objectives. So these are the objectives that I have to reach those goals. So partner up with a local government and community organizations to help arrange helpful resources, so food, childcare, transportation. Number 2, expand affordable broadband coverage in these communities to increase the use of telehealth services, online education, etc. Number 3, provide affordable after-school childcare services to families who do not have close family or friends nearby to take care or pick up their children after school. So we're going to go back to objective number 1, partner up with the local government and community organizations. I did speak a little bit about this. I would rely a little bit more on my local government, only because with every rural community it's different. You might not have as much community organizations as you think, or they might not have enough because they're barely hanging on. So I would rely heavily on my local government. Number 2, expand affordable broadband coverage. So a lot of phone companies actually have systems in place where you can partner up with them and they put their satellites and their information in these areas. So that is something I would do in order to increase the use of the telehealth services, only because that is something I'm very more focused on when it comes to rural communities. Again, I do not want someone who just can't make it to their appointments not to go and their health be affected by where they live, because everyone should be provided the same amount of things. And it's very sad that they don't. So the broadband coverage I would do more so for the increase of telehealth services. I did add online education because a lot of people have to stay at home after high school, and they might not have enough resources to get secondary education. And if we could do online education, they could move at their own pace and not have to worry about paying extra to take these classes online. So that was something else that I also added on here. And again, places like T-Mobile Verizon. Those two are the very big ones that do the broadband coverage. And there is a website that shows you their coverage, their plans, and who they have partnered up with in the past to put these up. So I do really like that. I did not do enough research to see how well they've worked, but I do know they've done them, so I really do like that. And then for number 3, provide affordable after-school childcare services to families who do not have close family and friends. So this was more of an after-school program, and I will talk a little bit more about that, but my idea for this objective was to do more of a high school mentor-mentee to this childcare services. So I am going to touch a little bit more about that once we hit strategies and actions, but that's the direction that I took for this objective. So some of the strategies that I had was identifying local government departments and schools and businesses that can provide food, childcare, and transportation resources. So I don't know if y'all ever had the after school programs, but in my school they would give us a little snack, and they would provide transportation from the elementary school to the middle school to the high school to the place that we were going to. And so that costs money. The gas that you put in these transportations, the snacks, the food that you provide, anything that has to do with just treating or taking care of someone, that all costs money. And so when you multiply that number to 5, to 10, to then 15, to then 20 kids, it can be very cost effective. So working with the local departments, local government departments, and schools that can provide you not only with the resources, but also their time, can mean so much. And then reach out to organizations and host partnership meetings to coordinate resource plan to build a partnership. So with all of the governments, departments, and businesses that I come up with, I would want to work with them to create a collaborative partnership for all of us to know what our goals are, what we want to see happen, what we don't want to see, everything, so that we can all work collaboratively and have each other's backs throughout something that we want to help the community with. Number 3, advocate for public and private funding to support the broadband affordability programs. So they don't tell you how much they are online, but I would want to, again, identify who my local government is, the businesses, everything, because they will also help fund the broadband affordability program. And again, that could be part of the resource plan that we built as a collaborative partnership. And then partner up with local schools and child care agencies to develop affordable after-school programs. So again, what does that look to us? How can we make it as affordable as possible? Is that either bringing kids from the high school to help out for 2-3 hours after school? Do we make it a tutoring area? So again, the high school children, they come and help tutor the students that have to stay after school. How do we make it to be as cost effective as possible, while also giving the kids the meaning of being taken care of? So that was something else that I thought about. And then partnering up with high schoolers to create peer tutoring programs for elementary and middle schools. So again, that's what I try to talk about, the mentor-mentee. I talked a little bit more about that, the strategy beforehand, like a buddy system. So how do we create something as affordable as possible yet effective? So would that be having the children come to the high school, having the high schoolers come to the elementary school, and having that time where they can take care of the children, whether that's with tutoring, whether that is reading a book, whether that is how is school going for you? Please tell me how your classes are going. How can I help you? Whereas with the high schoolers, I do think although it can be a little tricky, I think that is the way to go when it comes to making the most affordable after school care program. Because for the high schoolers, it's more of a I'm your mentor and I can help you and I want to help you. Whereas for the children is I'm I'm being with the big kids and I can learn as well as I can talk about what's going on. And then for the parents, it's more of a you're taking care of my child. And that's what they want. And in a way, it's still being effective because they're getting a tutoring program out of this and they're still probably getting the snacks and the food that they would get from a program. They're able to play if they want to play. So that was my idea. That was what I wanted to implement into this because from firsthand basis at my high school, we did something called Book Friday. So we would go to the elementary schools that was around our high school, and for our last period, we would go and read them books. And although it was only reading them a book and it was during school time, we still did. And we still did it because we wanted to. And I know that if we were to provide this program, people would sign up and people would do this because they would want to, because they want to see a change, because they want to see a difference. And it's a very good way to have children see what their future can look like and to see I will be in high school and I can be in high school. So it's not just about having an after school care program, it's more about I can learn being outside of school. I can play with the big kids. I can talk to the big kids. Because, again, this is more of a mentor-mentee. We can disguise it more as a mentor-mentee than it be, oh, can I afford this as an after-school program? So that's kind of what I really lean towards too. And then my actions. Find out what the community needs with surveys created. So, how are you going to know that the community needs something if only one person is telling you that they need it? How many more people than just that one person needs this same amount of resource, you know? This also helps with to see what we can prioritize because again, I do want everything to be prioritized, but what do we start with first? What is going to help us get to the other two programs? Develop a shared resource plan outlining community schedules and referral systems to ensure an efficient and structured coordination among the collaborative partnerships. So, yes, we created this plan, but how are we going to keep up with it? So, again, the schedules, when am I going to talk to you? Are we going to talk one-on-one? Are we going to meet as a group to then see, hey, what has the community needed throughout this time? And then schedule meetings with internet providers to discuss expanding their services coverage and establish free Wi-Fi zones in the community centers and libraries to ensure that residents can access online resources. So this kind of goes back to the telehealth. Yes, I want these broadbands at a time be put in areas super close to the people that need it. So in neighborhoods. I want them to be in every neighborhood. But you can't start with that. So I would put them in a community center or in a library where it's not too far for all the individuals and the residents to come to. And also it gives them that space to where if I need something, I can go to this targeted area and I know they will have the Wi-Fi for me to find these things or for me to join my telehealth service. So that was something that I really wanted to establish firsthand before we got to the broader having it in all the neighborhoods type of action. Develop with a proposal with the community survey to identify families who need after school childcare. So this was more of a type of survey of I know you need after school survey like a service, but how many children do you need it for? How many service hours? How many time do I need to put for you to be how much time do you need that I put into this service? So then we can plan accordingly to, again, the high school situation. Can the students be here at this time? Can the students stay for this amount of time in order for every child to have this after school program? And then meet with school administrators to secure space and support for after school programming. So obviously, we're not going to use the whole school for the after school program. If we get a gym, if we get a cafeteria, if we get 2 classrooms, and then outside, what can we do to secure space and support for these students that need the after school program? Are we dividing them by grades? Are we dividing them by the classes that they might have together? What can we do to secure enough space and the support for the after schooling program, which we will get from the community surveys of the families that helped us. And then this was more for the high schoolers in action. The tutoring, or just the time that you're spending at the after school programming, can count towards volunteer service hours or leadership experiences. So a lot of students might need volunteer service hours for college, for a job, whatever they want. They can use this time to benefit them. So yes, you are benefiting the children that you're helping by just being there, but those count. They count for something, and whether that's volunteer service or leadership experience, you can use it as anything. So that was an action that I had for my goals. And then reflection. So as a social worker, I would like to use more feedback mechanisms to collect feedback about the programs and ensuring ongoing improvements. So that is maybe doing monthly surveys. So every program that I have given out, what is working the best? What can we use more of? Are there any difficulties that you have seen using these programs? I want all the feedback that I can get from the town, from the community that is using all the programs that I have established. And I just want them to be satisfied. So with, again, what they share with me will be to only progress what I have built and update to the best of my abilities to, again, everyone be satisfied with the results. And then I would ask quarterly feedback from the partners who are helping with the local programs. So every month I would ask feedback from the community, but also I would want to hear from the people that are helping me help have these programs effective. So if they are lacking something, how can I help them? If they need to step back, how can I gravitate towards that? How can I help from that? So I want to hear not only from my community who I'm helping, but the people who are helping the community with me. So the programs, the local government, the businesses, all of that. I would conduct the meetings with everyone to know if I need to either ask for more funding. How is the funding going? Where is the funding going? Asking partner initiatives, all of that will be every 3 to 4 months. I feel like that is where you can see the progress of your work effectively, and also see, okay, let me see what I can change from what I have given. And so this whole process has helped me understand what it takes to actually make a change as a social worker. And it really helped me understand what I need from the community to advocate. This whole advocacy presentation and this project has been really more of a guide on what you need to advocate. And it's not just speaking on what you think is right, it's actually changing it. And it's not easy. I came into this project thinking I would blow this out of the park, but it's not. You have to research and see what can be done, see how you can do it differently, see what has been done and what has not worked. And it kind of puts you in a different mindset because you can see that other people have advocated for the same issues and they probably didn't get anywhere. And how can you change that? How can you advocate and make that change for the community that needs it the most? So that is really what I got from this. I used my personal experience living in a rural neighborhood with the little services to write about this advocacy plan. Yes, I lived in a rural community, and yes, we had limited resources, but there was people who advocated for change, and we did see change. And one of them was because of the broadband services that we got during COVID. We were able to be in our own homes and still be able to do our work because these services were put in place for us to not have to worry about paying an internet or having to go somewhere else to do our work. That I was seeing firsthand being done, and I think that was one of the best things that could have ever happened, especially during COVID. That was very unexpected. Not everybody saw it coming, and that was where a lot of the time all of the social services I spoke that we need more of kind of shut down. And so, again, as a social worker, people advocated and people did changes, and I think that was what I got the most of. Not only seeing how I would work as a social worker and what I would the steps I would have to take, but also seeing how in my personal life advocacy has been done and how it has helped change things in my little old town. So that is all that I have for y'all. I really hope that y'all understood what I brought and took something out of it. And yeah, I hope y'all have a great day.